At Florida Hospital Memorial Medical Center, we began our quest to the Governor's Sterling Award because of a drive for continuous improvement and performance excellence. In so doing, what we decided to do was to create performance councils that focused on organizational improvement, and we used the Sterling criteria in order to drive our performance metrics along with the PDCA cycle of improvement. Patient safety is very important to us, and not only do we focus on national benchmarks, but we focus on individual patients and harm events. One of the things that can harm a patient is infections in hospitals, and so we had pulled together groups of staff and management team alike, cross departments from nursing to pharmacy to cardiopulmonary departments, and we brought this group together to create a group to develop a plan of criteria to prevent infections. And they were very successful in that. We found that by bringing staff together that do the actual work, as well as the management team to ensure accountability, to reduce infections. And in fact, we have had no ventilator-associated pneumonias because of these processes for over 19 months, which is very remarkable in our business. Another aspect that was very important to us was the inclusion of physicians in our process improvements. Physicians are a large stakeholder group in our organization, obviously because they bring us patients, but also because they're partners with us in developing high quality care. So it's very important that we get their buy-in in everything that we do, but also that they are included in the process improvement as they are the experts in clinical care. One such example is in our STEMI improvement program. There are national guidelines as far as the time it should take from a patient who comes to your emergency room with chest pain to the time that that patient actually lands in the cath lab and has the blocked vessel opened up by a cardiologist. It takes many, many people in that process in order to create a great process to achieve results, and that is a fast timeline. Because as we know, less time means less muscle damage, and so that's very important to our patients. We had many people involved, not only departments such as the cath lab and the emergency department, but also emergency department physicians and cardiologists who are the actual ones who are on call and perform the procedure. Without including every single stakeholder group, we would not have been able to meet the goals that we have. We have great STEMI times, much better than the national averages and the national standards, and we're very, very proud of the processes that we have designed in order to get overall results, which is better care for patients.